All right. So the purpose of our meeting today that I'm arriving late to is to discuss exercise intensives. We had a meeting last month talking about research. There is a group in Italy that has done some really cool research studies looking at doing exercise intensives, helping people with multiple different experiences with Parkinson's, kind of just traditional. Can we help with mobility? Working with people early in their diagnosis to say, can we slow Parkinson's progression? People have dyskinesia, showing that they're able to reduce dyskinesia. And so we thought this sounded pretty cool. And we wanted to support anyone who's thinking about doing an exercise intensive and kind of problem solving through what that would look like, what you would do. And so we talked about the research last time. And today is really just supposed to be open forum. What questions does anyone have? Does anyone have a thought about what that exercise intensive might look for them and want to talk about it? So anybody have a question to get started?
I do, Claire. I'm like, what would it look like to get started? I mean, what would we do? And
So the what the research study was is people did 3 hours a day, 5 days a week.
oh,
They
okay.
did an hour of like mobility and stretching work, which I would say a power moves class is pretty similar. They did an hour of aerobic exercise and balance training. And then they did an hour of more OT focused type exercise, which is like daily activities, getting dressed, preparing food, moving around. And the research studies, I believe that all 3 hours were individual therapy. So it was working with a therapist one on one. That is not something that is easily accessible in the US. If you have to go into a hospital, you may get multiple hours of therapy in a day, but most cases in an outpatient setting, you're not going to get that much therapy. So we were talking about doing the same kind of intensive, but more with exercise and group classes. It is an option. You could access individual therapy as part of the exercise intensive if you wanted to. And that would basically mean, getting in touch with your doctor. If you have a clinic in the area, calling and scheduling, and letting them know, hey, I'm doing an exercise intensive and I want to do some individual therapy as part of it. So that would probably still, the individual therapy would probably be 1, 2, maybe 3 days a week. It would not be a lot of, it wouldn't necessarily be every single day. It really depends on where you live and what therapy clinic it is. So my thought is more that you're putting together kind of a plan with exercise classes and then supplementing with individual therapy if you really want to, or if that's something you feel like you need. And the time frame in the research studies, they did it for a month. You can do it for whatever amount of time, though. So when you're doing something like this on your own, you can take what the research study did and say, okay, I'm going to try to follow that as close as possible, or I'm going to take that into consideration, but I'm going to make tweaks that make it really work for me and my lifestyle. So they did 3 hours a day, 5 days a week for a month. You could say, I'm going to try doing this for a week and see what that feels like. And is it feasible for me? And then I might do another week and then another week. So that's, Billy, it's kind of taking like, what are you doing now for exercise? I think it's helpful to write that down. Say, what am I doing now for exercise? What did this exercise intensive look like? How far away is what I'm doing now from what that exercise intensive looked like? If you're pretty close to that, you might just be bumping up what you're doing for exercise a bit. If you are someone who's not exercising at all, I would not necessarily recommend doing 3 hours a day 5 days a week for a month. I would probably start with aiming for 1 hour a day, 5 days a week, and that maybe over the month you would try to increase towards the 3 hours a day. So it really varies depending on the person, what you're doing now for exercise, and what is actually feasible in your life in terms of how much time do you have to spend exercising per day? Do you have 3 hours to dedicate? Do you have 2 hours? Do you have 1 hour? And then basically like each person kind of putting that together. Does that help, Billy?
Yeah, I was going to say, because I know myself and a lot of us are already exercising 2 hours a day
Mm-hmm.
based off of the schedule, that you send us on the email. Like today was boxing and power moves.
Mm-hmm.
Tomorrow's cardio, and then I have a PD class that I go to in Wichita to help support that program. So that's 2 hours.
Mm-hmm.
You
So
know,
that's
but
where You
So
could say, I'm already doing 2 hours a day. And are you doing that? Would you say 5 days a week? What are
yeah,
you doing things on the
5 days
weekend?
a week. On Saturday, I usually walk or do something for 20 to 30 minutes.
Hmm.
Sunday, I try to get some walking in a little bit, but it's not anything that's really getting your heart rate up. It's more casual.
Hmm.
Saturday morning, I try to do 20 to 30 minutes. It gets my heart rate up. And then Sunday's kind of like my rest day. I don't stop moving, but I just do it at a leisurely pace.
And
So,
I just saw what the problem was. I did not, even though I put this meeting in our email, I did not put it on my schedule. So that is why I missed it.
Claire,
Um, so yeah, I just want to follow up on what Billy's saying. So Billy, then you could either say, I'm already doing 2 hours a day consistently. I feel like I'm doing this and I'm happy with what my exercise program is. I'm going to keep going as is. So you don't necessarily have to make a change. You could say for a period of time, I want to try adding that third hour a day and see what that gets me. And what I talked about last time in terms of the OT focus, to me, I mean, I am not an occupational therapist, and it is different than if you were working with someone one on one. If you worked with someone one on one, they would definitely have suggestions of specific things to work on. But I was saying that, that third hour of OT each day could honestly be food prep. It could be household things, like maybe somewhat things you are already doing, but you would say, I'm going to take an hour and I'm really going to dedicate. And the things that I'm doing, meal prep, household tasks, I'm going to do it big. I'm going to kind of emphasize the quality of movement. I'm not just going to do it, I'm going to do it really well. So that is the difference between just doing some household tasks, maybe in the afternoon when you're tired, versus making it more therapeutic, is focusing on how you're doing something, not just doing it.
okay.
But Billy, yeah, I mean, for a lot of you, if you're already exercising 2 hours a day, you're already doing an amazing job and you're doing that more consistently. In the research study, people did the 3 hours a day, 5 days a week for 1 month. And then the rest of the time, they were instructed to do some exercise and keep moving. But what you're doing on a continuous basis is already more than what the people did in that research study on an ongoing basis. And so I think you're likely already benefiting in a very similar way to the exercise you're doing compared to the group in that research study. So it's really up to you if you want to say for a period of time, I'm going to take it up a notch, or if you're like, I'm good, I'm committed, I'm doing a lot of exercise and I'm keeping myself busy and I don't really want to add anything else onto my plate at this time, that would be fine too.
Yeah. I
Claire,
may I may do something to try for just a week and just see if that makes a difference, like with some stiffness or soreness or something like that.
Yeah. And I'd say if you're already exercising quite a bit, it's going to be helpful if you have something specific in mind that you want to work on. Like the people in the research study who were having dyskinesia. So when they were working on those daily tasks, they were really working on being calm and thoughtful with their movements and really trying to minimize the dyskinesia as much as possible while they were doing those tasks. And they also even had 20 minutes where they moved in front of a mirror and they observed themselves and they practiced moving with less dyskinesia. So if you don't have anything specific that you kind of want to improve on or work on, I don't know that you will notice a difference if you add on a third hour. But if you do notice, hey, I get a little more stiff later in the day, or I feel slower, or I have some dyskinesia, or I have some off time, if you have something that you would like to improve on, then I think you would notice more of a difference. And if it is something like stiffness, you might say, okay, I'm doing my exercise in the morning for 2 hours, which is excellent. But you may say, okay, I'm going to do a 15 or a 30-minute power moves class in the afternoon to loosen up, or I'm going to do some stretches or movement on my own, or I'm going to go for a walk. So if you do have something specific that you're wanting to work on, you're going to be able to be, more thoughtful and targeted in what you add to your program. Does that make sense?
Yes, yes, thank you.
so Claire, I was wondering, so some days I'm able to get in the 2 hours and then other days just the hour. But with all that Rogue has to offer, that would be easy to come up with those 2 hours, a high intensive and an exercise, even if I have to do it on a tape.
Mm-hmm.
So I figure I'm a little more insecure on the OT part. So, I mean, I almost wonder if we could access like a Google Doc or something and we could if some of us have ideas or discovered something, like, so for instance, I know with my handwriting, other people are sad about their handwriting. And it's interesting, I have a order for OT. It was for OT and PT on the same thing, and they started me on PT where I'm at, which I'm not finding as useful as Rogue's stuff. But I don't know whether to see it through or not. I just kind of feel like I'm going there and I'm like, what the heck am I doing? I know I know what exercises you guys tell me to do for what. And well, anyway, that's neither here
Yeah,
nor
but
there.
I mean, I think like I would say you do want to be thoughtful and use your time well,
Mhm.
and also use the therapist time well, and use insurance dollars well. So for one, I would have a conversation with the physical therapist, make sure that they understand that you're doing a lot for exercise, that you have access to a lot of things. And I would say the only reason that it would make sense to do physical therapy is if there are specific things that you want to work on, or that they identified on an evaluation that they may be able to work on in a different way than we can in classes. There are certain things like balance and dual tasking and some activities that are harder for us to do in a class setting, or harder for us to really hone in on the right level of challenge for you. So like
I
you
did
should,
ask for balance.
okay. And is that happening?
Yeah, I'm a little worried, like, maybe I'll be able to stand on that board and not make it wiggle. And is that going to transfer over into real life or not? But, you know,
And I would really encourage you to ask about those things
okay.
when you're in therapy. Say, okay, I'm this is interesting to me, and how does this help me in real life? Because it makes a huge difference if you understand why you're training something and how that's relevant to real life. So I think that if it's beneficial for you, it'd be good for you to know why. And
Mhm.
sometimes when you bring it up, and it makes the therapist think about it, then they might be like, well, this is helpful in this scenario. And then you might say, well, actually, this is the scenario that I really notice a change in my balance, or this is how I want to work on it. Like when it comes to Parkinson's, in many cases, we don't want to work on static balance as much. That is standing still. Even standing still on different surfaces is not like when most people have falls. Most people have falls when they're stepping and moving. So that's what we want to work on, is dynamic stepping and moving, walking, changes in direction, turns, stepping up and over obstacles, around obstacles. So, having those conversations with a therapist is how you're going to understand what you're doing and how it's beneficial. It also allows you to kind of push the boundaries a little bit and make sure that what you're doing is valuable for you, and the therapist will learn a lot working with you. And if you're ever working with a therapist who gives you pushback and like doesn't want to answer your questions, or doesn't want to change up what they're doing to be things that are meaningful for you, in that case, I would say, yeah, don't work with that person. Like you you should only do therapy that is a good use of your time. And
Mhm.
not every therapist is, tuned in and
Mhm.
really cares about working. A lot of therapists are just burned out because they're in a setting where they're seeing, three therapists or three patients an hour, 10-hour days. They're bogged down with paperwork. So, don't feel bad if you're going to therapy and you're like, this is not really helpful. And I feel like I've asked questions and I've kind of tried and I've let them know what I want to work on. And I don't really see the value, or it's changing. It's totally fine to say, hey, thank you so much for your time. I really feel like I'm in a good place now with my exercise. I don't need any more individual physical therapy at this time, and I'll let you know in the future if I do. Don't feel bad about doing that at all. And then for OT, do you know why they started you on OPT? Is it like availability with OT? Was there a conversation at all about that? That they said, hey, we're going to start with PT and this is why versus OT?
No, I mean, I think because the neurologist wrote it as an assessment because I hadn't really been to a physical therapist since I was diagnosed. So they just had me go there, to do that first.
But it also says OT, and this clinic also has an occupational
They
therapist.
do. The specialty is, I think the person supposedly works with stroke patients in another office, not necessarily Parkinson's patients. So at first I was kind of a little hesitant, but I wasn't sure I could find somebody that specialized in Parkinson's with OT in my area. So I was just kind of, thinking about that.
Mhm. Yeah, so it's okay to not rush into it. And I'd say if you do have a little bit of time to do research or ask if there's anyone else in the area that or calling the neurologist's office and saying, do you know of an occupational therapist that works a lot with people with Parkinson's? You could do a little research and see, is there anywhere else that you might be interested in going? Otherwise, a therapist that specializes in stroke, may really specialize in neuro, and may be creative and be great, and have ideas. So definitely they're worth trying if there isn't someone better. But then same thing, going in, you could say, I'm, really looking for help on these specific things. And, do you feel comfortable? You can ask the therapist, do you feel comfortable helping me with these things? Or does that feel a little bit outside your area of expertise? A lot of therapists, I think, are trained to not be specific. Like the clinic that they work at wants them to just see everyone and anyone and not really think about the specialty. But like if someone comes to me and they have low back pain, I will say, like, I'm really not the person to work with you. We have a couple other therapists who have more orthopedic experience. They're going to be able to help you more. I'm good at a lot of things, and that's not one of them. And I'm fine saying that. And I'm fine helping people get to the right place. So don't be afraid to have those kinds of conversations with people. But I think letting the clinic know, hey, it was good to do a physical therapy evaluation and it's fine to work on balance, but my real interest area right now was occupational therapy. Is that something that could get started sooner than later?
Okay. So for instance, I had read or I'd seen where when you are practicing handwriting that you should practice really large. And like those children's pads where the lines are really big. And I know you can get those pads at like the dollar store by me. And I didn't know if like part of the OT, 15 minutes a day should be writing big. I mean, I don't know what that would be, but when I was trying to make up my own program and the things that when you were saying to Billy that she wanted to work on, like handwriting is something that's really rough for me.
Yeah. So, I mean, when you see an occupational therapist, they are going to ask you questions and they're going to evaluate, your movement and find out what's important for you. Something like handwriting is a pretty common change with Parkinson's, that handwriting gets smaller. So if you were kind of looking at a group of people, you could make a recommendation like handwriting is likely going to be something that's good for people to work on. But then it's really a matter, it's not just working on things that might be difficult, it's working on things that are meaningful to you and that you want to get better at. So that's where it is, the physical exercise is a little bit easier. We kind of know we need to do aerobic exercise. We need to do amplitude training like power moves. Balance training is good. It's a little easier to take a class and kind of apply it to each person. For occupational therapy, I'd say it's a little bit more individualized based on the person and what they want to work on. We do have a section in the video library. I'm going to share my screen. So we have a section on, what is it? I'll have to look and see what it's called. Fine motor activities. So I had also said that I think that speech could count as the third hour because speech, swallow, brain training, that's all really good. So for anyone who's doing speech class twice a week, I would say that already could count as your third hour on those days. And then in terms of recordings, if you are someone who has noticed a change in your speech or swallowing, you could do an additional speech class beyond the live classes, or you could use recordings if you're not able to join the live class times. Then right next to the speech recordings, we have fine motor activities. And Leanne made a video that is kitchen skills and tools. So this is something where if you also have a goal of eating healthier, maybe preparing more food at home, that would be a great video to watch because there might be some specific ideas or tools that would help you be able to prep food and cut food easier, better, with less work, safer. Knife skills are a whole thing because we want to be able to cut up fruit and vegetables, but we also want to be safe in the kitchen. And I sometimes am scared that I'm going to hurt myself with a sharp knife. So that video would be to check out.
Is that informational or is that exercises?
This is more informational.
Okay.
So this one is more informational. Intro to Leanne and fine motor class is an intro. But I think that informational videos would be enlightening because an OT talking about here's what I do, here's what we focus on, when I'm working with people with Parkinson's, I think that would give you some of the ideas of the kinds of things that you maybe would do in individual therapy. Sarah was an OT student who worked with us, and she has a series. So getting started, fine motor strengthening, and then handwriting. So those would be good to check out. And then Leanne and fine motor class. I think this is both informational and exercise. It's 47 minutes long, so there's a lot in there. She also did a handwriting update here. So this handwriting one and this handwriting one would be a good place to get started on things to work with. And then I recorded, this one is exercise. I asked you to have a few household things, and then we go through and we actually do exercises together. It's just 16 minutes long. And then Emily recorded a couple of videos, fine motor activities without any equipment at all, and then fine motor with some small pieces of equipment. So we do have these resources that would be a place to kind of get started that is focused more on fine motor. Fine motor is one area within occupational therapy. Occupational therapy covers just about everything that is important in your life. So handwriting, fine motor dexterity, dressing, bathing, meal preparation, driving, vision. There's a lot of things that OT covers. And so that's why we could definitely make a list. I also could check with Leanne and see if she might have availability to meet with us on one of these calls, and she could talk through what are some of the most common things that she's working with people on. Like, one thing I can tell you is taking amplitude and taking that into your everyday life. So the goal with power moves isn't just that you do power moves for an hour and then you forget about them for the rest of the day. The goal is that you take those bigger movements into everything that you do throughout the day. When you get dressed, when you bathe, when you meal prep, when you clean up around the house, it's that you're doing everything big and exaggerated. The goal is that there's really a carryover of that amplitude training into your everyday life. So that's where you could say, one day in the afternoon, I am going to make dinner and meal prep a little bit of other stuff. And you would do it big and you would do it well. And then one day you might say, okay, today I'm going to clean up around the house. And you would walk big around the house and you would exaggerate what you're doing. So like I said before, I would say a lot of it is doing things you might already be doing in your day, but it's just adding a little extra focus of how you're doing it, and that you're doing it big and you're doing it really well with big movements. And then that is kind of the translation of taking exercise into your everyday life. But I can certainly ask Leanne about joining us to talk about, what are some of the things that she asks people about and evaluates, and some of the most common things that she works on with people. So she could join us. I think she would be able to join us for one of these calls sometime in the next few weeks.
Claire, you talking about that makes me think of Stephanie and the Parkinson's Voice Project about doing things with intent.
Mm-hmm.
To stop and think during the day that, okay, I'm going to do this big.
Mm-hmm.
Doing it with intent.
Mm-hmm. Yep, exactly. So you can speak with intent, and you can also handwrite with intent. You can move around your home with intent. You can do everything with or without intent. And the more that you are mindful of what you're doing and how you're doing it and really do it well, the better for your brain.
Claire,
So, yeah.
you mentioned that and I didn't get a chance to read the article, and I'm here for Andy today because Andy had some surgery this morning, so he doesn't want to be on camera, but he's listening. You mentioned that the research article showed that doing an exercise intensives reduced dyskinesia. Did it show any impact on freezing of gait?
Mm-hmm. Yes. They also did a whole study specifically looking at people who had freezing of gait, and it was beneficial for that as well.
And you mentioned, there are all of the video virtual classes with Rogue, and Andy participates in those. Does Rogue offer any one-on-one part of that intensives, either virtual or of course in person?
Yeah, we definitely can. So in terms of online, we can do an assessment online. a little bit harder than doing it in person because there's some setup and we have to get you information. But doing an assessment is part of our membership in person. We do it when someone first joins and every 6 months. And that information can be very helpful in making choices and, us giving recommendations and then measuring things over time to make sure we're on the right track for where we want to be. So that assessment is something that can happen online, and a few of our members have done it. And then also one-on-one, either kind of consultation or exercise sessions can also happen one-on-one online. A consultation might just be that if you wanted to really sit down and lay out a specific intensive, for a month and you had questions and you wanted help putting that together, here I'm happy to ask questions, but if you really wanted to sit down just one-on-one, we could do that. And that's more of like talking in a consultation and making plans. Then we can also do actual exercise together on video. So yes, those are things that we offer. And if you're interested in doing a one-on-one with us, it's $180 for an hour. And we basically just coordinate the schedule. So we find out like what are the days and times that would be best for you. And we see what availability we have with therapists. If we have something that matches up well, great. If we don't have exactly what you want, we'll let you know what we do have. And that can happen regularly. It could happen even multiple times a week during an intensive. It could happen one time a week. It could happen sporadically, just anytime you need it and it's helpful. Maybe once at the beginning of doing an intensive and then a check-in at some point. So yes, we have that available and it's very flexible in terms of how that gets set up.
Is it $180 per hour for each of those sessions then? The
Yeah.
evaluation and then each subsequent one?
Yeah, anytime
Okay.
if it's a one-on-one.
Okay, and how do we set that up? Do we call that number that's at the bottom of your email?
Probably the best would be to send me an email. And I know you have emailed me and I haven't gotten back to you. So I
That's
am
okay.
also working on having
We got
times.
a small delay here with this surgery this morning, so.
Yeah, there's that. And I'm really working on trying to carve out time in my schedule to actually be able to be on my computer and respond to emails. Because right now I don't actually get that much time to be on my computer and respond. But the best right now would be to email me and let me know. And then I would basically put you in touch with Brittany. We haven't done a ton of one-on-ones online. So it basically would just be another thing with Brittany, our studio manager, of letting her know kind of how we want to, organize that and what we would look at to schedule. So I would kind of like help facilitate that and let her know, okay, this is something we're maybe going to be doing a little bit more of. And here's how we go about scheduling that. And then we set up, a Zoom link and we schedule an email to go to you with that Zoom link. We can also, when we do one-on-ones like that, we can record the meeting or the call or the exercise session. So in some cases, we record that exercise session and then the person might use that a few more times for exercise, because it really can be helpful when you're getting that specific to you type of feedback. So that's something we can do, is record and make that video available later on too.
We're in a pretty, I'd call it rural area, and there aren't a lot of power trained. And as you know, I'm a physical therapist and I am power trained. But the gal that kind of took over when I retired a year ago, she has not quite as many years of experience as me. So I'd really like it to be, through Rogan Motion. I've also reached out. You're familiar with Joy Cochran, and I've also reached out to her too. So once we get healed up, we'll be pursuing that through one or both of you guys, because in the last year, the freezing of gait has really become concerning. So
Yeah. So yeah, it definitely helps. Like the consistent exercise makes a big difference, but most of the time people really benefit from having that one-on-one kind of coaching and help to really achieve, especially when there's something specific like freezing going on. Yeah, sounds
Thank
good.
you.
So yeah, let me know when you're ready or interested in scheduling anything.
When I'm ready to put him into boot camp. That's what he refers to it. He went to the
Power
the
retreat.
the power retreat, yeah, in
Mhm.
2019, and ever since then he refers to those kinds of things as boot camp.
Yeah,
So,
they really are.
but it's so good for you and it makes such wonderful changes. So,
Mhm.
and I guess that's just the reassurance I'm I'm looking to hear from you is that you've seen significant changes with people through your through your PT wellness clinic there, and I just need that little reminder that it's real, it really does work, and that bit of hope.
Yeah, it's very important. And a lot of times the conversations we're having too is a little bit about medication optimization too. That a lot of times I think we're looking at things from a slightly different perspective than the neurologist, and we may be able to say, hey, like, what about this or that? And, can you be in touch with your neurologist? Do you have a little bit of freedom to try different amounts or different timing, within kind of have some guardrails? This is the least amount you're going to take per dose and per day, and this is the most you would take per dose or per day. But within that, have a little bit of flexibility to try different doses and different schedules, because that really does make a huge difference too. And I feel like sometimes just the way that neurologists look at it is a little bit different in terms of treating symptoms, whereas physical therapists and occupational therapists, we're really looking at function. And even just, different neurologists out there, some are kind of extra conservative with how they dose. Some are, we have a member right now who I haven't gotten a chance. I don't think Sarah's on here right now, but someone who is being told by their neurologist, like, your symptoms aren't significant enough, we don't really need to treat them. And that is really not her experience. So depending on, how you look, the one time you go to see your neurologist, they may have a adequate or like an accurate or really inaccurate visual of what your life looks like, because you see them so infrequently and under very specific kind of circumstances. And a lot of people can't help but move better and kind of perform when they're at a neurologist's office. We always want to, we all want to put our best foot forward. So a lot of times how people move in front of the neurologist is very different than how they're moving at home or when they're tired or when medications aren't working. And so really being able to be very clear in your communication about what is happening to the neurologist, and ideally having some control at home where you have the flexibility to make some changes to medication, because you and Andy are the ones who know what's going on at home. The neurologist sees a tiny snapshot of that. And as physical therapists, when we're working with people on a regular basis, we get to see more than what the neurologist sees. But what we are seeing is still a snapshot of, even if we saw someone every day for an hour, that's 1 out of 24 hours in the day that we are seeing. And most people are going to schedule visits out of the house at a time of day where they feel their best. So that's probably when we're seeing them. We're not seeing people at the hardest time of their day. We're not seeing people in the evening or overnight in most cases. So that, I think, is having a conversation with a neurologist. And I would say anytime you're doing an exercise intensive like this, and the goal is to work on freezing or dyskinesia, especially, you ideally want to be in touch with your neurologist and say, I'm planning on doing this. Part of me getting better is through exercise, and it's also through making some adjustments to my medication. The study where people had dyskinesia, they were in better shape. And one of the hypotheses is when you're spending so much time moving well that you really start to change the circuitry in your brain, but also their medication was reduced. So I think, like, when it comes to dyskinesia, most people who have dyskinesia experience it at peak dose. Some people experience it at end dose, but peak dose is kind of the most common. And so along with exercising well and doing more, ideally over time, your medication is being adjusted where the dose is being lowered, whether the dose just comes down and you keep the timing the same, or whether the timing also needs to adjust. Those are factors. So ideally, you'd want to have a conversation with your neurologist and say, I'm going to do this. I'm probably going to need to be making changes to my medication. Am I allowed to do that at home on my own? And if so, what guardrails would you give? Or do you want every single change I want to make to go through you? In which case, how can that happen? Can we be in touch via email or phone calls? Or when can I have the next visit so that I can be making those changes, accordingly as I start to exercise and make these changes?
Those are all really good points. And I think we have a really good neurologist because she is giving us that flexibility. She's made some suggestions about going from instead of a 3 times per day to a 4 times a day. And then she's even given us the permission to do a dose in between those 4 times a day. So, but what I'm actually seeing and makes, so there's two things here. So one is if you could go over how like exercising more seems to burn off this carbidopa levodopa, and yet I've heard that exercising more actually makes you need less carbidopa levodopa. So that's one, like I'm not quite like putting those pieces together. And the second thing is so his dyskinesia, he has on dyskinesia. So his dyskinesias are more when they're on. And our neurologist feels, and I haven't disagreed with her so far, that some people prefer to be a little dyskinetic so that they can just move. And again, it allows them to exercise. He's definitely having his freezing of gait at his off time. And it's almost like clockwork. Like, you know, he used to be able to go 4 hours between medicine, and then it was 3 hours. And now at 2 hours, he will start to have freezing of gait. So again, she's given us that permission. And we are actually supposed to have a consult with her today to talk about other meds or different types of dosing. And we had to postpone that because he had to take care of something else right away. So those are my two big questions. Or one is really just like, how do you manage that when you got the dyskinesias to be on, to be able to exercise, but then you burn through that when you're exercising, and it seems like then it gets harder to exercise.
Yeah. So in terms of the medication exercise, I would say first off is people are more likely to feel like they're using up more dopamine when they first get started with exercise or increase the intensity or do like a higher intensity on that day than they're used to. So that is that's a relatively common experience. Some people do actually need to take a little bit more when they're doing a higher level of intensity than they otherwise would do to kind of support that. But for most people, once they are consistent with that higher intensity level, they do not experience that feeling of burning through it anymore. So a huge part is the consistency of exercise. And once you get to a certain frequency and consistency, you will experience less of that feeling like you're burning through. And there also will probably, hopefully, be a time where there's a transition to you actually producing more dopamine yourself. Whether like when that happens, exactly how it happens, we don't know, because it is not something that we can look in someone's brain and be able to tell how much dopamine are you making. The study that showed increased dopamine production was out of Vancouver, Canada. It was a cycling study, a high intensity cycling aerobic exercise. I believe people were doing it 3 times a week. I cannot remember the exact duration of the study right now. It was something probably like 12 weeks. So some of these changes are things that may take time. You know, I think we're all impatient. We want to feel better in like a week or two, but changing the biochemistry of your brain and the physiologic response to exercise and activities, that there are things that happen in the short term, but a lot of the positive changes that we're talking about are things that happen over longer periods of time. So I don't know, I think it was 12 weeks, and I don't know that they necessarily measured throughout the study. I think they basically showed from the beginning to 12 weeks when people were exercising consistently. By the end of the 12 weeks, people were producing more dopamine on their own. And I think that what is important is acknowledging like where you are with exercise now and where you're hoping to get to, and then not going from 0 to 60 in a day or in a week, because that is just going to be too much for your body to handle. You really have to ramp your way up to where you want to get to over a period of time. Like in the Sparks 3 study that is happening right now, that's a treadmill training study where it's high intensity. I believe it's 6 months of exercise, and the goal is to be exercising 4 days a week on the treadmill. I believe the first 2 months of the study is ramping up from wherever people are to getting to the point where they're exercising on the treadmill 4 days a week at that higher level of intensity. So they have 8 weeks to go from point A to point B. So that is something that's important. I think a lot of people think, okay, I want to exercise at a higher intensity, and they go from not working at a higher intensity trying to really push themselves, and then they feel bad afterwards and they feel like they burn through dopamine. They might have more soreness and just overall, because if you aren't doing that kind of exercise, your body is not physiologically ready to do that kind of exercise. You have to say, okay, I want to get to the point where I'm working at 60, 70, 80% of heart rate max. That isn't something you do tomorrow. That is something that you slowly work your way up over time. So first step when it comes to aerobic exercise is actually endurance. So we don't really worry about the intensity level in terms of heart rate first. And I think I have this kind of mapped out on our website. Let me see if it explains it well.
How
We
many
have a-
hours per day in that study? You said 6 months, 4 days per week. How many hours?
So in that study, they're only doing 1 hour, 4 days a week.
Okay.
So that is different than this three, there's a lot of different studies out there looking at a lot of different ways to do exercise. Doing 4 days a week, I would say they're really doing they're the study where they're trying to get people at 80% of heart rate max. A lot of studies do not actually try to get people quite that high. In the Italy study, I don't think people were working all the way up to 80% of heart rate max in most cases. So you probably kind of get away with a little bit lower intensity if you do a longer duration versus a higher intensity in terms of frequency in a shorter amount of time. So there's a lot of different ways to do exercise. Doing 3 hours a day, 5 days a week for 4 weeks is not necessarily the right way for everyone to exercise. It's not necessarily the best way to get started with exercise. When it comes to working your way up to high intensity, this page on our website, which I'll put the link in the chat, and then I will also put it in the daily email tomorrow.
Okay.
But it's basically just roguept.com/cardio. And it is me kind of trying to explain, what do we mean by high intensity and aerobic exercise? How do you get started? How do you progress? For cardio class, and this is the specific online class where we have a piece of equipment. We've had some people recently joining us not using a piece of equipment, but still getting, like, whether you use headphones or something and you go out for a walk outside, you can still do speed 1 and speed 2 with us. You can do, if we do a hill, you can do lunges and other things for strengthening. So there is a way to do it without equipment, but our main focus has been with equipment. So first step, though, is to build endurance. So you can do this type of exercise for 40 minutes. So whether you are on a bike, on a treadmill, on an elliptical, going for a walk, number one goal is whatever speed, whatever intensity level, just get to 40 minutes. So you don't have to be walking fast. The goal is just to build up to exercising for that period of time. So that's the first step. And if you do it, you even take rest breaks as needed, and you go whatever pace works. And so if you do this, that might take a few weeks for someone to get to the point where they can do 40 minutes straight. Once you can do 40 minutes straight, then we're going to start focusing on speed more. So if you're walking on the treadmill, we're going to be bumping up that speed. If you're pedaling on a bike, we're going to start paying attention to the speed and the RPMs. Once you have been able to bump up your speed a little bit more, we may be measuring heart rate intensity during this process and seeing some people might already be getting their heart rate up here. But if not, I would not be concerned about that. I would say that's okay. Endurance is the first goal. Once we're able to increase speed, we might see more of a heart rate response where people are getting their heart rate up higher. Or for some people, it takes the third step. Like for me, if I'm on the treadmill going back and forth between speeds, my heart rate elevates, but I do not get to, I probably maybe just barely get to 60%. I definitely do not get to 70 or 80% heart rate max if I'm just adjusting my speeds back and forth on the treadmill or on the bike. For me to get my heart rate up, it has to be a combination of speed and resistance or incline. And that's when I can actually start to get to the true higher intensity level heart rate wise. So once we get the speed going, then we start to add resistance. That's the third step. Resistance, whether if you're on a bike or elliptical, or incline if you're on a treadmill. And then we start really doing our intervals. In our cardio classes, we're doing the intervals right from the beginning. So if you join a cardio class, you can follow the intervals as much as you're able to. But if you're just getting started with this type of exercise, you don't have to do every single interval we do. You can kind of listen. You may still find joining the class motivating to hear things, but you don't necessarily have to do everything that we did. We also do have some cardio classes, I believe, in the video library that are more steady state, where we're not doing a lot of changing it up in terms of speed and incline. And we also have some beginner cardio classes. I think we have a 10-minute class, a 20-minute class. So if you're just getting started doing aerobic exercise, that can help work your way up to doing what we do in our typical classes. So this is basically where you want to start. If you're not really doing aerobic exercise consistently right now, you want to start by building your endurance, then your speed, then the resistance or incline. And then after, it might take 3 weeks, it might take a month, it might take 6 weeks. It's different for different people because it also depends on other aspects of your health. Do you have any other medical conditions that impact your ability to exercise? If you have diabetes or a history of cancer, or you've had surgeries, or you have any heart disease or anything like that, all of those are going to influence your ability to push yourself with exercise. So it just means it might take a little bit more time. You can probably get where you want to go, but this might be something like where if right now you're not exercising a lot, you might say, I want to do an exercise intensive at some point in time. My goal is to do that in 3, 4, or 6 months or something like that. And you're just going to get really consistent with exercise initially leading up to that, and hopefully get to the point where you can do a higher intensity and get your heart rate up more. So that's a question about medication and kind of dopamine, that when you first start exercising, when you try things. Oh yeah, speech class today too. Yes, Kahaya, I will wrap this up. And we're going to have to redo. I am so sorry about my schedule mishap and not putting that on the schedule and completely forgetting about it until we got phone calls. Thank you for calling me, but we'll continue this conversation. So you base like medication, you will feel like you're using it more initially. As you get in better shape, you will have less of that experience, and you will start to hopefully actually feel better when you exercise. You might feel like you're producing more dopamine. You might feel like you don't need as much medication. You might just feel better and have more energy. But that hopefully is the transition that happens. But that really requires consistent exercise over a period of time to get to that point. And then you also mentioned that some people are okay with a little bit of dyskinesia because they can move better. Absolutely. All symptoms are on a spectrum, and some people feel a little better being a little lower on medication, and they prefer that. Some people feel better being a little on the higher end, and they're okay with a little bit of dyskinesia and they can move better. That is absolutely fine. So yeah, dyskinesia and freezing is not like an absolute, oh, you shouldn't ever have that, or don't let yourself experience that, but it's just figuring out what works for you. And still over time, the goal would probably be just to try to minimize that and have your experience be as smooth as possible. Not everyone's going to have 100% smooth experience. There's still probably going to be some ups and downs for people. We just want to get it as smooth as possible. All right. So yes, we will.
I just had one last question kind of related to that. I put it in the chat, but it's basically, some people have a hard time getting their heart rate up for various reasons. But if they are one of those people, is the talk test or the rating of perceived exertion going to be efficient enough for them to get their heart rate, so to speak, to get to that intensity of workout that it seems they need to be at?
Yeah.
Again, totally appreciate your comment, though, that you should do endurance first, work on endurance before intensity. That makes a lot of sense to me. But once you start heading into intensity, if it's somebody who you don't really know if they have that autonomic involvement or not, with getting their heart rate up.
Yeah, definitely RPE, so rate of perceived exertion, is a valid way to measure exercise intensity. So on this same page here, we have a sheet for rate of perceived exertion that we made that kind of explains from 0 is no effort, like you're relaxing and meditating, all the way up to an all-out sprint, the fastest, hardest you could possibly move, what it will feel like, and kind of what are the activities that match up with it. So it kind of matches up in research where about a 6 could be like 60% heart rate max, 8 could be 80% heart rate max up to 100. So this is totally a valid measurement to use for exercise. The other thing is when people do have autonomic involvement, a lot of times what it does, and even just some older adults, cap like have their max heart rate is lower than what it would be otherwise without Parkinson's or without that autonomic involvement. In the Sparks 3 study, the way that they say what someone's 60% and 80% heart rate max is, it is not an estimate. So most of the time when we use apps and things, it is estimating your heart rate max, taking into account possibly just your age, or ideally your age and your resting heart rate, so that if you do have autonomic involvement, there's a good chance that you have a lower heart rate to start with. So we'd want to take that into account. You may also have less of a robust response in terms of changing your heart rate when you're exercising though. So in the Sparks 3 study, what they did is they took people and they did, forget what it's called right now, but basically a test to determine what is this person's max heart rate, taking into account any heart disease and Parkinson's and autonomic involvement. So someone who's, 60, we might otherwise say, okay, we think your max heart rate's 140. Well, you might go in and do a test and find out, nope, 110 is the highest your heart rate is ever going to go. And if that's your max heart rate, then your percentages of 60, 70, and 80% should be relative to what your true physiologic max heart rate is. So for one, if you're trying to do the higher intensity exercise, you could just do RPEs, not worry too much about it. You could track heart rate and see, am I at least getting towards the 60%? Maybe I'm someone with autonomic involvement and I'm not ever going to get to 80% of an estimated heart rate max. But if you at least could get over that 60% threshold, that would still be beneficial. Or you could say, hey, I see a cardiologist and I do a stress test. I'm going to ask them, during this test, what was my max heart rate? And I'm going to do a calculation from that heart rate to use for my 60, 70, and 80% so that it is more valid for me based on the fact that I have autonomic involvement. There isn't a lot of research, so much of the research has focused on heart rate, and they maybe, didn't allow people to participate in the study if they had autonomic involvement or they didn't see a change. My experience clinically is we have a lot of people who are doing aerobic exercise, endurance exercise on the equipment, and they are not seeing a huge elevation or change in their heart rate. And in most cases, they are still benefiting from it. So, some people are experiencing a lot of challenges, but for a lot of people, if they are doing consistent endurance exercise, they're still getting a lot out of that. And when it comes to a symptom like freezing, we don't want to go super fast because freezing usually is small, fast steps. And we don't want to, can't think of the right word, like practice that. So in many cases with freezing, the first step is actually to slow it way down, go slower and work on bigger steps, and then see what speed can we increase to where the speed step size is still a good quality step size, but we may never go as fast like on a treadmill or for walks outside because we don't want to promote the freezing. So the approach is a little bit different depending on the person. And we might say, okay, we're going to use a bike to get the heart rate up higher because that is a safer, better way to do it than on a treadmill when we really don't want to be pushing speed. We want to keep the speed a little bit slower to keep the steps big. All right. So sorry, everyone.
Can I ask this question on the last point?
Yes.
Where your maximum heart rate is not the mechanical calculation. Is that formulaic to the extent you have, like if you had a heart problem or had something else, would be, minusing out a certain percentage, or how would you come up with 110? How is that better than the 180 in your example?
So the typical way of estimating max heart rate is there's a formula called the Kevorkian formula, which also is on this page.
Right, it's 220 less
Well,
your age.
Kevorkian formula is a more complicated formula. So 220 minus your age is the most simple formula for estimating, and it tends to underestimate what the heart rate needs to be to get to those levels. Kevorkian formula actually takes into consideration your resting heart rate. And on this page, we link to one of the places where you can do the Kevorkian formula. So let's say you're 60 and let's say your resting heart rate is 80. So if we calculate the old method of 220 minus the age comes up with these numbers. Kevorkian formula now says, okay, 60% is 128, 70% is 136, 80% is 144. So that is an estimate based on age and heart rate, but not taking into account something like autonomic involvement from Parkinson's, which may blunt the heart rate response. Then if we say, okay, we kind of think this person does have some autonomic involvement, their resting heart rate is actually 50. It's quite low in the first place. So then we do that calculation again, and 60% is now 116, 70% is 127, 80 is 138. So it has dropped the numbers down somewhat, but not a huge difference. So that's ideally, you do have your resting heart rate and age calculated to start with. Then I believe it was also in the Sparks paper where they said to take into account the autonomic involvement from Parkinson's, we're going to go ahead and take another 5% off that. And I would have to re-look at it to see exactly how they did that. I'm not sure if they would say, okay, instead of 75%, we're going to call this 80%. And we're going to say for a person who's 60 with a resting heart rate of 50, 133 is the 80%. And what would otherwise be 65%, we're going to call 70. And what would otherwise be 50, we're going to call 60%. So we are going to take into account autonomic involvement, and we're going to make an adjustment by a percentage. That study was the only one where I really saw them discuss that, and they said a 5% change. Then when I was mentioning the 110 though, so I was saying in that study, the way that they calculate 60, 70, 80% is they brought each person who participated in the study in, and they did an exercise test to determine what is this individual person's max heart rate. If we get them on a treadmill and we walk as fast as they can, how high does their heart rate go? And so let's say that person, a person who's 60, theoretically, their maximum heart rate is 160. That person might come in to participate in an exercise study and their heart rate never goes anywhere near 160. Maybe their heart rate, the highest it ever goes, is 110 or 120. And so in that study, what they did is they said, we're not going to do this estimated calculation. We are going to test each person physiologically, see what is the highest their heart rate goes. If your heart rate goes up to 120, that's the highest we ever see it go, then 120 by 80% is 96. So for that person in the study, as long as they're getting above 90%, they're getting above 80% of their max heart rate. So the difference in those numbers was there's 3 different ways to do it. There is to just estimate it based on age and resting heart rate. There is estimate it, but then adjust it by 5% to take into account autonomic involvement, or there is to do it a true physiologic test, which in this study, I can't remember the name of the exact test. It's not exactly the same as a stress test with a cardiologist, but it's pretty similar. So if you see a cardiologist and do a stress test, you could ask them and say, what was my max heart rate during this test? And would that be valid for me to do a calculation to get a more accurate measurement for me of what 60, 70, or 80% is compared to an estimate? Does that make sense?
Yes.
So yeah, it's complicated.
Not an easy answer to the bottom line.
Yeah, it's not an easy answer. So with thinking about doing these intensives, and whether for some people it's going from not doing too much and just trying to get consistent with exercise, or some people being consistent with exercise, trying to do a little bit more. I really understand that having these conversations and kind of us being able to coach you through that is helpful, because what everybody's going to be doing is a little bit different. So I'm going to look at the schedule, but what I'm thinking for the next 2 months, basically September and October, is we might even have weekly meetings. And obviously you don't have to come every single week, but if you're going to try to do an intensive in September or in October, or you're going to go from where you are now and you're going to try to do more consistently over time, we can have meetings to help you along. Hey, I overdid it. Okay, let's talk about that. What was too much? How can we back off without going all the way to 0, but keep going? Because that's what we see a lot of people when they first get started is they do too much, they don't feel well, and then they don't do anything for a few days. And then it's this back and forth situation of too much, nothing, too much, nothing. Let's be smarter and say, this was too much. Okay, let's do half of that. See, how does that feel? Is that the right amount? Okay, do that for a period of time. So I'm going to look at the schedule. It may be Tuesdays at 1 p.m. and I will actually put it on my schedule. But I'll be in touch with all of you about that, and we'll kind of do a little bit more dedicated exercise coaching to be able to answer questions. What are you doing? How are you doing it? Maybe that's when we bring in Leanne, to talk a little bit more specifically about OT. And yeah, because there's obviously a lot to talk about. All right. Well, thank you all for who joined for our talk about exercise intensives. I really apologize to everyone who's joining for speech class right now that we just took up 20 minutes of your class. Hopefully the discussion on exercise was at least a little bit interesting.
I thought it was really interesting.
It is. I mean, there's so much. It's so complicated. I 100% want to test all of our members and see what is their true physiologic max heart rate so that our calculations in exercise classes could be more accurate.
Yeah.
And it's just a matter of figuring out, okay, exactly what is that test? How would we implement it? What are the safety risks? If you're really trying to push people to their max heart rate, there's, the potential for things going wrong. So we
Right.
have to be prepared for that. So that's just another thing that I haven't had time to do yet that I really want to do and haven't had time for. My to-do list is like
A
7
mile
pages.
long.
Yeah, exactly. But it's very fun to have these conversations and answer questions like this. So thank you all for
Claire,
joining
will
those.
you be putting those PRE and the other calculators, the PRE chart that you put up and the other calculators that you put up, at least the link to them in your email? That would be super awesome.
Yep.
Thank
will
you so
do.
much. Really, really appreciate this, and sorry to the speech
Oh, that's
class
okay.
people.
If anyone has a question for Claire, you have to say it with intent.
Mhm.
Intent. There you go.
Anyone want to put together speech class and our exercise discussion all at the same time? I have to say, Stephanie, I mean, our discussion that we just had, I could hear and understand everyone who asked the question very well.
Yes. Our whole group is amazing.
Mhm.
And many people, it's been years, right?
Mhm.
No decline.
Mm-hmm. Yeah, very cool. And that's what we were talking about too. If you're doing an exercise intensive, part of it is taking what you do in exercise classes, whether that's physical or speech class, and really taking that into your everyday life.
Sure.
That you might do speech class 2 times a week, but then part of your exercise intensive could be, hey, you're going to go out to dinner with your friends, but you are going to really focus on that speaking with intent for the whole hour.
Mhm.
That is the transition from exercise into real life that really helps you experience longer term benefits, which I know you talk about all the time.